Hi, I'm Bill Patton. I'm the CEO here at Holy Cross Medical Center. We're a 25-bed hospital in Taos, New Mexico. I've had the privilege to lead here at Holy Cross for about 3 years. And one of the topics that was on the radar when I was recruited was replacement of our EMR systems. Our core hospital system we had for 22 years. We had a standalone ED system that was not fully interfaced to that system. So I knew coming in that this was going to be a project we needed to work on. As we looked at what was out there, one of the things that we wanted to do was to make sure that we had data that was easily retrievable, both by our clinicians, but also billing office, administrative staff, across the board. We needed to be able to get at all of this data that we were now going to be putting into the system. So as we looked at the options that were out there, we actively involved the people who would use it. And in the emergency department, it was the doctors, the physician assistants, nurse practitioners, and the nurses. They were an active part of the conversation to choose a system. And with their input, we chose Wellsoft. One of the challenges that we faced when we had the old system was that we were asking our providers to document in two systems. They had to document in the ED system, and then they had to repeat that documentation in the hospital system. Very inefficient. With our new Wellsoft system, we have a fully functional interface that allows documented information in Wellsoft to flow easily into the hospital evidence system.
My name is Krista Castro. I'm an advanced practice clinician at Holy Cross Hospital in Taos, New Mexico. Previous to using Wellsoft, we used a chimera of two systems, Meditech and T-System. This was problematic for many reasons as the system was not integrated. Our emergency department was looking to find a new ED-specific EHR, so we personally called Wellsoft ourselves after researching the class ratings, and Wellsoft was rated #1. They were happy to oblige and came and gave us a demo, and ever since then,
My name is Brittany Lamandola. I'm the Director of Patient Care Services at Holy Cross Medical Center. We benefited from the improved patient safety, and that was what we were looking for primarily. Because of the barcode scanning, the ability for nurses and providers to be documenting within the same system, and the added benefits of reporting so that we can tailor our behaviors within the department. All of these things have benefited our facility since the implementation of Wellsoft.
I would say our implementation with Wellsoft was exceptional, and I have worked with 5 other EHRs, and Wellsoft is beyond reproach.
You know, you cannot compete with the customer service that you get from Wellsoft. They're a phone call, a text, or an email away, and they are so responsive. And when they call back, it's a friend that you're talking to. They understand the urgency of the fact that we're calling or have a need because they know it's an emergency room. They know that we can't stop the flow. They know that if something isn't working the way we need it to, it can affect the outcome of a patient's life. Everything is done perfectly and specific to our needs. It's just that you can't beat their customer service.
I'm often asked, how did the install go? How would I rate the success of this project? And speaking specifically to Wellsoft, I would give it a 10. Wellsoft was a great partner. They were easy to work with from a contract perspective, but what really set them apart was the installation team. For a CEO to know the install team by name, I think is unusual. And yet I knew them, I could send them notes, they responded quickly, they took our concerns seriously. They were a 10, no doubt about it.